Now, doctor, electroconvulsive therapy, another garma garam topic for the NEET PG exam, doctor. Out of the 5,000 topics of Dr. Murali Bharadwaj to make you the successful winner for the NEET PG, DNB, AIMS, JIPMER, FMGE or any damn exam in the world which gives you a medical license. You have to be very sure. 5,000 areas को अगर आप मास्टर कर लिए तो मुरली भरद्वाज के साथ कोई भी आपको रुकने का शक्ति नहीं रहता इस दुनिया में for you to pick up the dream branch of your choice. So ECT, indications, contraindications, adverse effects, they are all the important issues which you have to be very sure about, doctor. So what are the indications of the electroconvulsive therapy? Can you give me the board? So whiteboard basically makes us a little slow, unlike a PowerPoint slideshow. That's the reason I will use sometimes the whiteboard to make you to think along with me and slowly imbibe, assimilate the things along with me so that you are in a position to reproduce it in the tomorrow's exam. Okay, doc? So that's the reason we'll go a little slow, but we will go very deep and we will be well fixed, well assimilated about this concept. Number one, depression. Kitne varieties of depression do you know, doctor? If you don't know, you will go into depression in tomorrow's NEET PG exam. Major, severe depression. Major depression, minor depression, mild depression, severe depression. So, major, severe depression where there is a suicidal tendency or delusions and hallucinations similar to a psychotic state, otherwise called psychotic depression, becomes indication for electroconvulsive therapy. Then depressive stupor is second indication. Puerperal depression, pregnancy के बाद, delivery के बाद, puerperal depression and postpartum depression is indication for ECT. And depression where there is a decreased intake of food and fluids. So depressed people can be so depressed that they are not eating, they are not drinking. That becomes an indication. Then speeder recovery you want. Unlike taking the slow onset psychotic drugs, psychotic antidepressants, you want a speeder recovery ECT. Similarly, elderly patients, now comes a very interesting question. Is pregnancy contraindication for the ECT? No. First trimester of pregnancy with depression is an indication for the electroconvulsive therapy. Then depression with physical illness is an indication, and schizoaffective type of a depression. Schizoaffective depression is also an indication for electroconvulsive therapy is what you need to remember. Then that is the story of depression and ECT. Then what is the second important indication of ECT? Obsession or compulsion becomes an indication. Third, schizophrenia is an indication for electroconvulsive therapy. So, what are the specific things in schizophrenia? If there is a catatonic schizophrenia, or if there is a catatonic stupa, indication for ECT. Then acute schizophrenic episode, ECT. Then puerperal schizophrenia, ECT. First trimester of pregnancy in a schizophrenic, ECT. And schizophrenia with depression, ECT is what you have to ultimately remember. Then what are the other 4 important indications for electroconvulsive therapy? Mania. So mania also is an indication for electroconvulsive therapy. Then what are the features in mania that make ECT indicated? If there is a excreted or uncooperative patient, uncooperative maniacs need ECT. Then bipolar mood disorder with rapid cycling if it is occurring. That is, you are quickly going into depression, elation, very rapid cycling. Similarly, bipolar disorder with mixed behavior or the mania in first trimester of pregnancy becomes indication for electroconvulsive therapy. Then the 5th is postpartum psychosis, please don't forget. Then schizoaffective disorder is an indication, and psychosis in first trimester, please don't forget doctor, first trimester is an indication for the electroconvulsive therapy. Now, if you broadly summarize all this story, you can be able to say what are all the conditions in general becomes an indication. So you should remember, in summary, once more I am summarizing you the indications of electroconvulsive therapy. In summary, depression, psychotic depression, schizoaffective disorder, schizophrenia, mania, and you should not forget Parkinsonism also is an indication for ECT, and dementia with agitation. There is an entity, dementia with agitation. If you see Alzheimer's patient, he will be completely shouting in the ward, loudly screaming in the ward. So agitation and dementia. Similarly, catatonia and neuroleptic malignant syndrome. Typically psychotic, when a schizophrenic is receiving neuroleptics, he may develop neuroleptic malignant syndrome. There you cannot continue the neuroleptics. There it becomes an indication for the electroconvulsive therapy is what you have to remember. Now comes, what are the contraindications for ECT? So please don't forget this list doctor. मैं बार-बार 1000 बार बोल रहा हूँ क्योंकि 1 in 5000 lists of Dr. Murali Bharadwaj, secret formula for NEET PG winning, उसमें ये भी आता है. This is one list you have to remember, repeatedly asked in the NEET PG, DNB, AIMS, PGI and all exams. Contraindications of ECT is a very important question. So, if the patient is having an increased intracranial tension or acute myocardial infarction, or if there is any severe hypertension, or if there is any cardiac disease, aneurysm, thrombophlebitis, bleeding disorders, or risk of thromboembolism, they are all considered to be the contraindications of electroconvulsive therapy is what you should basically remember. Similarly, if there is any cerebrovascular accident or a severe pulmonary disease, or if there is any fracture, dehydration, fever, retinal detachment, congestive cardiac failure, or any contraindications for anesthesia, they are all considered to be the contraindications for the electroconvulsive therapy is what you should remember. Now, doctor, what are the side effects of ECT is a very, very important point you should know. All these things are available in all entrance books, doctor. No big deal. But ध्यान से दिल लगा के सडनली एग्जाम हॉल में प्रेगनेंसी में देता क्या रे, देता या नहीं देता, देता या नहीं देता, ऑडिटरी हैलुसिनेशंस कीप किलिंग यू इफ यू डोंट नो दिस. अगर देता है तो फर्स्ट ट्राइमेस्टर में देता या सेकेंड में भी दे सकता क्या? नो कंफ्यूजन डॉक्टर. विनर्स डोंट कंफ्यूज. Winners are precise, right? They expect it, they chase it, they kill it in the exam hall. They are the hunters, right? So I want you to be a very strong hunter. You should expect it, you should face it, you should kill it. It's like facing a lion. A MCQ is like facing a lion in the exam hall. You should anticipate when you are in the middle of a jungle. You should be well equipped to kill it, shoot it, and be very sure. So doctor, what are the side effects? This is one lion which is going to come to eat you if you don't conquer it. Very, very important. Pen paper lena, दोस्त के साथ बैठना और conquer करना. So sometimes ECT can be a cause of death. But generally when ECTs are given with general anesthesia, it is the anesthesia that lead to death. Most commonly. Then headache, body aches, memory disturbances, especially if you give bilateral ECT, memory disturbances, then confusion and post-ictal state. Post-ictal state will be prevailing. Vomiting can occur because of the increased ICT. Any of them can be the side effects of the electroconvulsive therapy. Then there can be a thoracic spine fracture, long bone fractures, and dislocation of the shoulder. Dislocation, most of the dislocations are all anterior, but those, if you see a posterior dislocation of the shoulder, one of the causes is electroconvulsive therapy. Then any arrhythmias, aspiration, and muscle pain, nausea, any of them. So death, headache, body aches, memory disturbances with bilateral ECT, confusion, post-ictal state, vomiting due to increased ECT, then spine fracture, dislocation of the shoulder, and arrhythmias, aspiration, any of them can be the side effects of the electroconvulsive therapy is what need to be remembered. Give me the board. When do you call it as modified electroconvulsive therapy? Suppose if you give barbiturate, methotrexate, sodium or thiopental, and ultra short acting depolarizing agent like succinylcholine, and then do the ECT under anesthesia, it is called as the modified ECT is what you have to basically remember.